Hi, I'm Chris Lockhart, and my presentation is over the promotion of metered dose inhalers over nebulizers, which was a evidence-based practice project that I completed this semester. Rural family nurse practitioners routinely assess and evaluate patients with chronic obstructive pulmonary disease and asthma. Patients with these diseases present to the primary care offices and to the local emergency departments with exacerbated symptoms which require administration of medications either through a nebulizer or a metered dose inhaler. The question that we had when we started this process were, in patients requiring administration of inhaled bronchial dilators, is the use of a metered dose inhaler versus a nebulizer an effective alternative? The significance to nursing is huge. In 2010, there were nearly 300,000 ER visits that listed COPD as their primary diagnosis, 1.8 million that listed asthma. That same year, there were 14.2 million primary care office visits that listed either asthma or COPD as their primary diagnosis. There's estimated 18.7 million adults and 6.8 million children diagnosed with asthma, and there's 6.8 million adults diagnosed with COPD. We performed a literature review, and for this presentation that I presented, we identified 5 published peer-reviewed scholarly articles. They included both qualitative and quantitative studies. They were all recently published within the last 5 years. And all studies utilized convenient sampling, but yet they were geographically dispersed across the globe. 2 of the studies were performed by the same authors for replication. And study designs included retrospective chart reviews, randomized clinical trials, and post-intervention interviews. Sample size ranged anywhere from 50 to 330 participants. Following careful consideration of the data and the literature review, it was proposed that metered dose inhalers be considered as the primary delivery device for bronchial dilators in acute and primary care settings. The method of promoting this evidence-based practice consisted of presenting a PowerPoint presentation to an air medical transport service based in Frankfort, Kentucky. The intention of this program was to inform the providers regarding evidence-based findings in the literature, encouraging them to consider utilizing metered dose inhalers in the acute and primary care setting. The information synthesized in the literature review was presented to the Air Methods Air Medical Transport team. And that group was chosen as they were agreeable to allow participation in the presentation, and the staff always utilizes nebulizers to administer to bronchial dilators in the acute care setting. Assessment staff revealed nurses with greater than 10 years of experience in the emergency and critical care areas, and 4 paramedics with pre-hospital experience ranging from 8 to 30 years. Patient care guidelines were in place that directed their care, but which would allow the use of a metered dose inhaler. The promotion of this evidence-based practice followed the Johns Hopkins model, and this process began with the development of a specific question, which related to the metered dose inhaler that we already covered, and followed by the literature review. Once the problem and question had been identified and the literature evaluated for credibility, then the information was combined with clinical expertise and patient preferences to accumulate into proposed evidence-based practice. We utilized the Knowles Adult Learning Theory as a theoretical framework for the teaching session. Presentation of the evidence-based practice information was made using the PowerPoint presentation, which was delivered to the Air Methods clinical staff. Participation by the flight crews was voluntary and informed consent was required. Evaluation of the presentation was solicited from the participants at the end of the presentation. The presentation was successful in prompting conversation among the flight crews. Several of the flight nurses reported on the lack of metered dose inhaler use in the acute care settings they had worked. All the flight crews were asked for constructive criticisms on the presentation. One staff member suggested adding a demonstration of how to properly use a metered dose inhaler. Further evaluation of the effectiveness of the presentation could be obtained through future chart review to see if metered dose inhalers were used when available to the flight crews. This presentation could be further developed into a longer, competency-directed education offering that included inhaler use demonstration. My references are made available to you there on the poster presentation, and if you have any questions, I'll be happy to answer those for you. If you'll please post those on Blackboard. Thank you.